a topic that's very close to my heart, especially when you're diagnosed with young children and trying to understand how to have those difficult conversations and conversations I went through and remember them as if it was yesterday. And it was interesting. And we were just speaking to our guest speaker today, and what I remember and what now my grown children remember, because I did poll them. I asked them since we were doing this tonight, are completely different, are completely different. So, just the advice I want to say is be gentle with yourselves, and try not to wear too much heavy on your heart, because as moms we do. And the kids, they remember some things, of course, but other things are incredibly resilient. So I'm really excited about hearing what Jean has and giving us some wonderful tools, right, Erin?
Yeah, absolutely. I think we'll all walk away today with some really good information, some things to think about, and even some support offerings in all of our communities that we can tap into, so we can support family and all of the members in that unit.
And Erin, I think we have to give our wonderful sponsors another shout out. What do you think?
Absolutely.
We'll put that slide up. We can't do what we do without them. Our supporters and sponsors, Erin and I have been doing this for 4 years now, and we do 36 plus of these events, and we can't do it without support, right? So a big shout out to our presenting sponsors, West and Merck and Daiichi Sankyo, and we have support coming from GSK, Lilly, Gilead, Pfizer, and Immunogen, which is now part of AbbVie. So thank you to all of those sponsors. We love seeing this list grow. When that list grows, our community grows. And it is just a key initiative and partnership that we could not do without. So thank you all for your support.
Absolutely. Perfect. And then let me introduce Jean Hartford-Todd. She is a child and adolescent life specialist at the Duke Health System and has been there for more than 36 years. She began working at Duke Health on the inpatient pediatric units in 1986, working with children and teens who were hospitalized with various serious injuries and illnesses. In 1996, she began working at the Brain Tumor Center at Duke, focusing on the needs of children and teens who have a parent with brain cancer. In 2013, she joined the Duke Cancer Patient Support Program and expanded her services, offering psychoeducational support to all adult oncology patients treated at the Duke Cancer Institute related to the needs of children and teens in the family. She's also co-director of the Kids Can Support Group for children and teens who have a parent with cancer. So please join both Sue and I in welcoming our first guest this evening, Jean Hartford-Todd.
Great. Thank you so much, Sharon. It is a pleasure to be here. I am passionate about what I do, and it's always exciting for me to be able to share information with people beyond the Duke community. I'm going to go ahead and share my screen, and I do have some slides. Here we go. So if you are an adult living with cancer, this cartoon might ring very true for you. It's from the New Yorker, and it really demonstrates how challenging it can be to have some of these hard conversations with children. And I was thrilled to find it because I thought it was a very articulate way to get the message across in a light way. So I'd like to talk about first, what stops us from talking to children about cancer? And if you are a parent with cancer, you could probably write this list yourself. I'll read through some quickly and then pause on others to explain what that bullet means. I'm afraid I will cry in front of my children. I don't want to scare them. They won't understand. They are too young to worry like this. They won't even notice they're in their own world. And I'm often told that by parents or grandparents who just describe their child as being incredibly bright and you can't put anything over on that one. And then they, say, oh, but no, we're not going to tell them about the cancer. So it just shows that how hard it is, that disconnect is there. My friend or family member told me I should not tell them it is cancer. You know, a parent was going to and then thought, oh, maybe I shouldn't. If I tell my children, then I will have to deal with the reality of the cancer whenever they want to talk about it. You know, as adults, we protect ourselves from many topics, and especially with very young children, preschoolers, once they know the word cancer and start having questions, they'll shout it out in the line at the grocery store. So it can be hard to share that information and know that you don't control it anymore. Your children do. Protection of the youngest, this was something that happened to me one day, probably 10 or 15 years ago. I met 3 or 4 new patients in one day, boom, 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 one after the other. And I went to the first room and the parents said, oh, well, our kids are 4 years old and 2 years old, and we've told the 4-year-old everything. He knows it's cancer and he knows I'll get medicine and he knows my hair will fall out, but we haven't told the 2-year-old. Of course, they don't understand. And I said, okay. I kid you not, I went to the next room and the parents said a version of, well, our kids are 10 and 8, and we've told the 10-year-old everything. You know, they know I have cancer, that I'm getting treatments, you know, my hair's going to fall out, I'll be very tired. But we haven't really told the 8-year-old much because they're just young. They're just too young to understand. And then I went to the next room and the kids were like 14 and 18, and I heard the same story. We've told the 18-year-old everything. We haven't really told the 14-year-old, you know, she's young and we don't want to worry her. And the light bulb really went off for me that when we have kids, we often compare them, even subconsciously, to their siblings. And if we see that younger child as less able to understand, less able to cope, we sometimes try to protect them by not giving them information. And so I just encourage parents to try to think of your youngest without any comparison to the older kids. Really just think about their personality, what they understand about other topics. And it's easy to think you protect them by not giving them information, but honestly, that can backfire and actually make it harder if their fantasies take off about what they think is going on. And we'll talk a little bit more about that later. And then, of course, if I tell them I have cancer, then we'll have to talk about death, and I don't know how to do that. Even parents with very curable low-risk cancers feel that fear, right? That word, we just equate cancer with death, and it's really hard when kids are involved to untangle those two words and really focus on what you can say about the cancer that could have nothing to do with the possibility of death. And we'll talk more about that later as well. I do hear sometimes parents say, I don't understand the illness well enough to know how to explain it to my kids. And that's where you can maybe pull aside a staff person. And I'm going to name some professions, whether it's a PA, a nurse practitioner, a nurse, a social worker, somebody who might not have that sort of pressure to get in and out with the visit, but might have a little bit more time to sit with you and field your questions on things you don't understand. And then just the bottom line is, I don't know what the right words are. I don't know how to do this. So why should we talk to kids about cancer? I found this quote by Austrian psychiatrist Rudolf Dreikers. Children are keen observers, but poor interpreters, which mean they really pick up on everything, right? They see it, they hear it, but they don't always understand what it means. And they don't understand what is really going on. So they might, it's fascinating that they might actually be relieved to hear you have cancer because they were worried that you're dying right then, you know, or that you're getting divorced. So giving them the information they need, the next bullet to make sense of their world. You want them to be able to understand what they're seeing, what they're hearing. And if you don't give them the real information, they do sometimes make up their own reasons for events if they're not told the truth. And often those made up truths are much more confusing or frightening than reality. And the example could be that they literally think you're dying when you're afraid to tell them you have an illness that, yes, some people die from. Beware of the grocery store encounter. How many times I've heard this? You are out in a public place and a well-meaning friend barrels up to you, not really paying attention to the fact that the kids are right there at your elbow. And they say, oh my gosh, I heard you have cancer. I'm so sorry. My uncle's mother-in-law had the same kind of cancer. And they're often telling what is typically not a great cancer story, right? They think you want to hear, and they really aren't even aware that your kids are standing there. And that happens. I would rather your kids hear the information from you first. That way you take control of who tells them, how it's described to them, where you tell them, and how you define that word cancer. And when you don't tell them, you give up some of that power to the random encounter that might occur in their presence. And a huge thing for just parenting in general, whether it's talking about cancer or sex or drugs or whatever, is we want your kids to trust you and to know that you are the safe and reliable source to talk about hard things. And this is hard. So look for professionals in your community if you want help and support. But we want your kids to say, this is really hard, but I can talk to my mom or my dad or my grandma. We can do this together. There we go. So what do you say? I am also passionate. I mentioned this earlier when we were meeting before we brought everyone on. So often professionals will tell parents, well, you just need to use honest, age-appropriate language to tell them about your illness. And I just get so angry when I hear that, because I think if parents knew what that was, they wouldn't be asking for help, right? If you knew how to do that, you wouldn't say, well, I don't know how to tell my kids. And so in the work I do at Duke and here in this presentation, I've tried to put the words that you can use and to get a sense of how you can talk to your children, and then you can tweak this for your own family. So for very younger kids, kids who don't really understand cells and cell division, you can simply say, I have a spot, or I have some spots of sickness in my body that don't belong there. We can't see the spots with our eyes, but the doctors could see it when they took some special x-ray pictures of, and you might need to say, of the inside of my body. The spot of sickness is called cancer. If you hear us saying cancer, you will know that we are talking about that spot of sickness. And then you can say the type of cancer I have is, and then you name the part of your body where it started growing. So I have breast cancer, it started in my breast, or ovarian cancer. And then if you want to give them a little more information, you can say cancer is a spot of sickness that tries to grow bigger. And sometimes it tries to move to new places in the body. Cancer is not contagious. I did not catch the cancer from anyone, and no one can catch it from me. It is impossible to catch cancer from another person. And the other thing I would add here is you also need to let them know that it's nobody's fault. Kids sometimes feel responsible and think that they think that they're responsible for the cancer sometimes. So letting them know that it's nobody's fault that the cancer illness, started growing in your body. I'm going to jump to older kids, but what you would do with a younger child at this point is move right into talking about treatments, which we'll do after we talk about the older children. For older kids, the wording is not a lot different. And what I did is I put together a handout because the detail for older kids is too much to put on a slide, but it talks about cells and cell division. And it talks about the fact that our bodies are made up of cells. They're like little building blocks, and that sometimes cells get damaged. And when that happens, that's a cancer cell. And that healthy cells make more healthy cells, and cancer cells make more cancer cells. So you can read over that handout. And I'm amazed at, when I started this 20 whatever years ago, I would only talk to high school students about cells and cell division. And as time has passed and kids watch TV shows like The Magic School Bus and they read books about cells, I will talk to kids as young as 7 and 8 sometimes about cells. So you know your kids, you know if they're interested in science, and you will, I think, be able to read these options and pick the sentences that fit your kids the best. So how do kids respond when they hear this news? If they had no idea at all, and then you tell them and you say that word cancer, part of what will happen is either the child has no idea what cancer is, and they're kind of like, okay, but probably they're sensing the anxiety in the family and the worries that the parents are having. So even if they don't know that word, they're probably going to sense, okay, I think this is something big, something's going on. If kids do know the word cancer and they do understand that sometimes people die from cancer, that's where the conversation can really stop. And what I'll say about this is I'm talking about a new diagnosis, but this can pertain even to future conversations if by chance the cancer grows and you need to change treatment. So this can apply at more points in the illness than just the diagnosis. So those kids might become very upset and just start crying. And that's okay. That's a normal, healthy response to hearing about cancer. And I would just pause the conversation and give them some hugs and snuggles. And there are ways that you can reassure them that you have a lot of friends and family members who love you, that there are going to be people helping you, at this time, and just give them a little bit of time to feel their feelings. Don't rush them through that. And then you can start again and talk about treatments. But this is the range that I see here. Some kids shut right down and become silent, and you don't really know what they're thinking, right? Are they bored? Are they shutting down emotionally? So I just tend to say, give those kids a bit of information and then let them think about it and say, I'll check back with you in an hour or two to see how you're doing. And then maybe in an hour or two, you give them a little bit more information. These kids might be slow processors who just need to learn and hear in little bites. Some kids might surprise you by saying, I already knew that. And then it's great to say, well, how did you hear that? That's right, I do have cancer. How did you hear that? And it's important to know how they heard that so that you know if what they heard is accurate, or whether what they heard even made sense to them. And I'm going to take a minute just to move my bar here because it's covering that last sentence. And then as we talked about later, you can explain, that we'll talk about later, you can explain the treatments that you will have. I don't know why my screen is not advancing when I hit. I've never had this happen. There we go. Some kids will just immediately start asking questions. Well, how did they know? How did they see it? What are you going to do? And I would encourage you to answer them the best you can. If they're really hitting you with a lot of questions, you can say, this is great. I love that you have so many questions, but let's write them down so that, we can sort of go through this in an orderly way because it might feel too overwhelming otherwise. If they ask a question that you don't know the answer to, again, validate that their questions are very important and that the next time you talk to or see your doctor, you will ask that question if you can't answer it right at that moment. And if you have an electronic medical record where you can send messages to your healthcare oncology team, that can be a great way just to send a question that anyone on the team can answer. Make sure you let them know the age of your child, just so they have a sense of, is this coming from a 6-year-old or a 14-year-old? And then you can share that information with your child. And then, as I mentioned, they might just become upset and crying. You just pause, you hug them and hold them, talk about your support community, talk about the doctors and nurses and all the staff at the hospital who will be helping you, and let them know that even grown-ups have a lot of feelings about cancer, and it's really okay to have these feelings, and that you're going to, support them, and they're going to get support from other people too. And then how to talk about the treatments. And again, even if you've already started your treatments, I hope some of this helps if you need to move on to the next treatment. Explaining chemotherapy and letting them know whether it's a pill or an IV medicine. And if your kids have seen IVs before, you can remind them that that's what I had in my arm or my chest. And then let them know how your chemo will be given. And we are going to talk about side effects, but again, I'm saving that for a slide that's just about side effects. If you're not sure how to explain some of this, again, I would ask a social worker or a nurse or nurse practitioner PA if they can help you know sort of the pieces that might be helpful to your children. If you've had or going to have immunotherapy, explaining that our bodies have an immune system that's made up of cells and organs that fight infections and sicknesses. And that a lot of times that's all our body needs to make a sickness like a sore throat go away. But with cancer, we need to use some treatments or medicines to get that immune system up and fighting and recognizing the cancer. Otherwise, the immune system doesn't really recognize the cancer. And for really little kids, it might just be that they know it. The name is immunotherapy, and that's a medicine you're going to get. But for older kids, they might really be interested in hearing that the immunotherapy is going to rev up your immune system, let it recognize and attack the cancer cells in the body. And I mean, it's really fascinating. And I can only tell you the progress that has been made since I started working in adult oncology in 1996. I mean, we weren't talking about immunotherapy then. I would encourage you to take photos of anything of yourself that you can, because your kids might enjoy seeing that. So if you're sitting in your chair getting your chemo, you could ask your family member or a nurse to take your picture so you can show the IV pole and show them what the IV is. The same for radiation therapy. If sometimes that's moving pretty quickly and they try to move people in and out, but if you have your camera already and you're on the table in a way, if you need to be somewhat disrobed for your treatment, then you could just ask, can I take a picture of the room and show it to your kids? If you're not disrobed at all, you could ask the staff person if they could take a picture of you lying down. And I'm realizing I'm going to go back because I did hit 2 slides last time, because we're also going to talk about surgery and radiation. So some kids have actually had surgery, and so they have an idea of what that is. Talk about trying to remove the cancer as much as they can. Sometimes they try to take out just the spot of cancer. Sometimes they have to remove a body part, like a breast. And so whatever you're going to do, you could tell your children that. And then it's very common that folks have surgery and other treatments. So I would just normalize that for your kids, that sometimes when a person has surgery, we just know that there could be some little pieces of cancer or cancer cells left behind. So it's really normal for people to get other treatments in addition to the surgery. If your kids have an understanding of the skin being cut for surgery, talk to them about the anesthesia experience, and that there's this really amazing medicine that will make it so you don't feel the surgery, you don't hear anything, you don't see anything. You can actually say, it will look like I'm asleep, but I'm not asleep. Sleep at night, we wake up from. These medicines are very special. And I won't wake up during my surgery, but I will wake up right after. And so, and some kids might say, well, what if you don't wake up? And then you can say, if I am slow to wake up, they have medicines they can give me to make me wake up faster. Because that can be a fear for kids sometimes. And then radiation therapy, I say to kids, especially school-age kids, do you know we have invisible medicines at the hospital? Isn't that crazy? And then I explained that your mom will lie down, she'll be on a bed. And I actually show a picture of a room that shows radiation therapy. So that's where, if you can take the picture of your room, you can say, this is the bed I lie on, This is the machine where the invisible beam of radiation comes out. I don't feel it at all. It just goes in through my skin to where the cancer is or was, to try to find any cancer cells that are in there and zap them and destroy them. Okay, this should have been page 2. And then I was going to talk about, taking photos if you can to add to these discussions. And the one thing with photos is at any hospital, you have to be careful that you don't get any other patients or family members in the background, but just because for privacy's sake. So you can take your own picture or ask staff to take your picture, but just look behind where you're taking a photo to make sure no other patients or family members are in the shot at all. When I encourage parents to talk about side effects, I encourage parents to really focus on the side effects that their kids are likely to observe or hear about. Typically, the big ones are fatigue, nausea, and hair loss if you're expected to lose your hair. And what I want to do is normalize this for kids, because kids sometimes will see a parent taking a nap every day or vomiting or just feeling really queasy and not eating. And if they don't understand this is a normal, expected change from the medication, they might think you're getting much sicker or that you're dying. So it's better to say, we don't like it that this happens, but in addition to the important change we want to have happen, which is to destroy the cancer cells, we know these medicines make other changes. My body is going to be very tired and I am going to need extra naps. My stomach might feel queasy. And if you're going to have hair loss, make sure they know some kids do think that's from the cancer rather than the hair loss. Rather than from the treatment. If you didn't tell them a side effect, but you realize they're becoming aware of it. For example, sometimes parents don't tell kids about cold sensitivity right up front because it's not so visible. But suddenly you realize that you're saying, could you get the ice out for me? I can't, that's uncomfortable. I can't do that. And that's when you can just jump in and say, this is a change, another change the medicine has made. And it's made my fingers really sensitive to the cold. And so I'm just going to ask other people to do some things around cold areas for now. Just again, we're just trying to help them make sense of their world. And then the most difficult question, and I'm watching the time, so I am going to speed up quickly. But you have this in your handout, so I'm not going to read all of these, but I put 3 different ways to answer questions about the possibility of death. Anyone, even if you have what's considered a low-risk cancer, a quote curable cancer, you can start here because they're going to hear that sometimes people die from cancer. If your cancer is more advanced, either at diagnosis or becomes so later, these are a couple of different ways to answer that question that are still honest. And then if you ever get to a point where it seems as though a hospice transition is approaching, that's when I would just encourage you to reach out to the social worker, to a local therapist, and really get personalized support for your family. And then what helps, I'm going to whiz through this, but you can read it and it's very clear. Helping them understand their world, we've already talked about. Knowing whether your kids are information seekers or not. If they want a lot of details and if that calms them, great, give them a lot of details. If it doesn't, limit the many details and just give them the base of information so they know what's going on. Let them know about changes to their own routines and schedules and who will be caring for them. Let the school know what's going on so that they can be a set of eyes and ears for you and can reach out to you if there are changes. As you talk about the changes that will come to your family, also talk about what will stay the same to create a sense of stability amidst all this change and chaos. So you'll still go to your same school, you'll have your same friends, you'll still go to Girl Scouts on Tuesday afternoons, that type of thing. Keep your family's rules and expectations. Don't just say, I'm too tired, I can't deal with this, do whatever you want. Say, we have a family rule that you only get screens on the weekend, but I think I'm going to be really tired this weekend. So I'm going to make an exception and allow you to have more screen time. They hear that the rules are still in place and that you're saying it's okay to watch more, not that you've just thrown up your hands because you can't do it. And then let them feel their feelings, as we talked about earlier. And the last bullet, provide opportunities for active play, and it's in green just because it's not on your handout. That was something I thought of. And just let kids run, jump, throw, and really get out some of that energy physically. And then there's a detailed handout if you want to wonder, should my child get counseling? And that really explains itself, and it just can guide you as you decide whether to get counseling for your child. Okay, sorry about running late. I knew that was a risk. Let me stop sharing my screen. There we go.
Thank you so much. And as Jean was moving through, I did add the links to her PowerPoint slides, and I will add in her most recent handout that she mentioned. So all of that is in the chat for all of you. Any questions before we bring the rest of our panelists on to begin our discussion? Okay. Wonderful. Well, let me bring in our next two panelists to share some more perspective with all of you. And again, feel free to add your questions in the chat or raise your hand. I think we can all tell Jean is such an expert in this space, so please feel free to pick her brain about that. First, I want to introduce Desiree Bender. She is an artist, an educator, wife, mother, and a breast cancer survivor. She started her career as a muralist, painting murals in communities all over Philadelphia through the Mural Arts program and as a freelancer. For the last 6 years, she switched to a smaller scale educational art environment with just 30 kids in a classroom as a K-4 art teacher. Desiree went for her first mammogram at 40 and was diagnosed with stage 1 breast cancer. With the support of her husband and 12 and 6-year-old girls, Desiree is working toward healing and finding a new life balance. And then our next panelist this evening is Catherine Wright. She is originally from Owensboro, Kentucky, which is where I believe she is this evening. She is a rising junior in the School of Nursing at the University of Pennsylvania. This is her second year as a KESM counselor and her first year as one of the outreach coordinators. And Catherine will share a little bit more about the KESM program and how and all of the programs that they offer to support children with parents affected by cancer. So please join me in welcoming our entire panel this evening.
Great. Thank you so much, Erin. Desiree, I wonder if you would be willing to start. I know Erin referenced your cancer history. If there's any information you think it would be helpful for the audience to hear about that. And then I would be interested in hearing what your thought processes were as you went from the adult getting the information from the doctor to the parent who needed to tell this to your children of very different ages, I will mention, not just two that you could necessarily sit down together.
Well, I think the quote that you mentioned in the beginning was very on point, I felt like, for my 12-year-old. When I went for my first mammogram, and then it was mammogram, and then it's ultrasound, right? And then from ultrasound, it's biopsy. And I was having a conversation with my husband in the kitchen about, they want me to have a biopsy. I heard from the living room, my 12-year-old say, what about the, it was like instantly, like her ears were like, biopsy?
Yeah.
So I think I started the conversation with her pretty early. But just informing her like very specifically what was happening. I mean, obviously I didn't have any news yet. I felt like we went on the ride together that way, in the sense that each step was sort of a little bit more bad news and a little bit more bad news and a little bit more bad news. I feel like, especially after the lumpectomy, and then realizing that it wasn't just DCIS and it was stage 1 cancer, and then having to revisit that conversation after trying to reassure her that oh, it's just DCIS. I'm just going to have this small surgery. It's going to be over. Then I think even after the surgery, how long the recovery takes, how hard it is on your body and your mind. But I think that she, at the age of 12, is very, busy with friends, very preoccupied. But as soon as there's sort of that quiet time, right? That's when there's tears. That's when there's like a lot of feelings. And I think also at that age, it comes out sort of sideways, where like some behaviors or things that might manifest because of stress or feelings about what's happening. And then my 6-year-old, my 6-year-old's a lot of just what I can't have anymore that I used to be able to have, and using things like mommy has boo-boos now, and mommy's sick, but mommy's gonna get better. I didn't say cancer with her. I think seeing your slides, I'm like, well, she probably, she's hearing those words anyway. It's probably worth saying them to her. But a lot of it for her, and we'll see, I think, interestingly, what Sue mentioned about how they grow up and what they remember, for her, what she'll remember about my surgery and recovery and all that. I think it'll be interesting over time. Yeah.
Yeah, and if you decide to tell your 6-year-old the word cancer, I would encourage you to do it very casually, not sort of oh, what I had was cancer talk, but you could just say, I realized I never told you the name of my sickness. If you hear us say the word cancer, it's that boo-boo that I told you about. And keep it pretty casual, but then she'll know the word. How do you think that would work for her?
I think that would be well. I mean, I think we definitely have been tried to be very like open and talking about everything. And I've tried to be very open and talking about the things that I'm going through as much as feels appropriate. I think that I think what stood out to me has been each person's different sort of reaction to me telling the information. And I think for other women, right, like we might be able to see the other emotions sort of mirrored in other people, but we're sort of feeling them all the time. So it does feel like a balancing of like what makes sense to share and what makes sense to talk to the appropriate person about, I guess.
Did you think about telling your kids' schools, or did you decide to do that or not do that?
I did reach out to my older daughter's teacher, and I let her know what was going on, so that she was aware in case there was anything, anything that happened at school. She was aware of what's going on.
Right.
And also, but my 6-year-old actually goes to the school that I teach at, so they all knew what was going on, and they were very supportive for me and for her.
Okay. And that, as your 12-year-old gets older, you can imagine, for if people listening have teenagers, they might be incredibly angry if you discuss the possibility of telling the school. And then I think you just have to use your parent judgment as to whether you say, I need to let one person know. Who's the one person you would be comfortable with me telling? Or you can decide not to tell the school and just be aware that there won't be that extra set of eyes on them, but maybe you could ask their friend's mother to just be tuned in or something like that. So teens are very different. Yeah. What did you find the most challenging, Desiree, through all of this?
Well, that's a difficult question.
Okay, maybe is there one thing that wasn't?
Lots of things.
Yeah.
I think probably just with my 12-year-old is very intuitive and very very tuned in about everything that's going on. So there's no hiding from her. There's no like putting on a pretty face or, and I think that it was always a lot of like when to talk about things and how to talk about things. but trying to be as clear as possible too, because I do think there is some kind of balance between like um overwhelming them with like too much information, or you don't want to place all the scary things that you're feeling on them as well. So I just tried to be really specific, and also to talk a lot about ways to help, like things that she does all the time that make me feel good. Like just try to be like positive things that she does or could do, or asking her things that she wants to do. Like if there's, in the time that I was home from the surgery, um, talking to her about like, hey, when you come home from school today, what's like a fun thing that you would want to do?
Mhm.
I guess just to try to keep all that, it's really an impossibly hard time. Um, so to try to make, I guess, some bright spots in there.
Mhm. In there somewhere.
Yeah.
Yeah, thank you. And I'll ask you one more question, and then Catherine, I'll jump to you, and then maybe at the end we'll go back and forth. On hindsight, is there anything you wish you had done differently with the kids, or do you feel like, no, actually that went okay. I think I did what I needed to.
I think I did okay. I feel like maybe even earlier, I feel like I could have just because now knowing like how everything sort of played out, like maybe being clearer with her like from the beginning, like what can happen.
Mhm.
I think I was always, but I mean, obviously, like naturally, you want to stay. You would be like, this can't possibly happen. This is, like this is not going to happen. Um, and maybe being clearer about like appointments and things like that. Oh, well, tomorrow I'm going to have another appointment. But I think in terms like, especially when I came home, um, from the surgery and everything, I feel like my husband and I did a pretty good job of juggling that and balancing
Mhm.
that. And I feel like really the benefit with my 6-year-old, I would say, was that she was going to the same school that I teach at, so that it was like everyone there was her little mom. So
Mhm.
she was like feeling lots of really special vibes the whole time.
Great.
And they really stepped in a lot when I couldn't do a lot of things to really support her. Uh, that took some weight off of, you know, um,
Yeah.
things that she needed from me.
Yeah, I'm so happy to hear that. I also hear from parents in general, but also parents who work in the school, that sometimes that attention is overwhelming to kids. So if you're in our audience today and you're thinking about who knows what at school, whether you work there or don't, think about your kids' personalities and whether having a lot of adult attention would be supportive to them and sort of loving, or would it be too hard and overwhelming? And then you can communicate, maybe asking only one or two staff people to sort of check in with the kids. But I love to hear your youngest's experience. That sounds wonderful for her. Great. Well, thank you, Desiree, and I will loop back, but I am a huge fan of Kesem, Catherine, so welcome. And I'm excited to hear what you have to share.
Before I start, I think Erin has something she would like to say.
Oh, thank you.
Oh, thank you. So before we jump in, one of our attendees this evening shared some really wonderful information that I wanted to pass along, looking for a little bit of guidance sort of outside of the younger child experience. So she shared she's having a hard time dealing with the diagnosis of having cancer. She doesn't have small children, but her oldest son is 39, her grandson is 18. They're seeing her cry a lot, and she can't really speak about it, nor can she explain why she has this emotional response regarding her diagnosis. So I wasn't sure if you had some tips for her to share how to communicate, and to know also that those emotions, it's perfectly okay and normal.
Yeah, that was the first thing I was thinking, is that's not unusual at all. And I know some families who actually dig deep and they're able to, use a bit of humor, like, oh gosh, mom's got the waterworks going again. But it sounds like that might not be your family's way of coping. And I would encourage, if you haven't already, to reach out to the social worker where you're being treated, or a mental health provider if there's a different type of mental health provider at the cancer center. Because even though those feelings are normal and to be expected, that doesn't mean they're easy. And it's hard to live with them. And so the first step might be giving you a place to share and have those very normal feelings in a protected environment. And then if you are able to do that enough, you might find that they don't leak out so much when you're here and there and everywhere. So I think just acknowledging that you deserve and you have a right to that support. If financially you can swing a local therapist, looking for that could be helpful. And if not, then looking to your treatment center. But giving yourself that outlet to feel those feelings in a protected space, so that maybe you're not feeling the need to cry as much in other places. And I'm curious, I don't know if you know, Erin, how long ago the diagnosis was. Because if it's a brand new diagnosis, of course, but if it's been longer and she's feeling like, oh, I should be beyond this by now, then that would definitely be a reason to look for a therapist or someone to provide support.
I don't have that, but certainly I welcome the individual if they want to message me or come off of mute to certainly share as well if they feel comfortable.
Yeah, great. And I hear that a lot when I'm talking about the little kids. I hear, oh, well, how do I tell my 86-year-old mother? You know, there's a lot of mutual issues, no matter the ages, right?
Yeah. It looks like she had a recent diagnosis just in May.
So all the more normal. And even then, though, if it still feels hard for you that this is going on, I would look for that support in a protected space where you can just feel those feelings and let them go, and then see if that eases some of the times that you're having at home with family and being so tearful. And then I would also just tell them, these are normal, healthy feelings, and encourage them, if it's uncomfortable for them, you could see if they can get support, have a meeting with a social worker or something. Does that sound okay for now?
Yeah, that's fine.
Yeah, okay. Thank you.
It's
for
hard.
sharing.
It's just hard to accept.
It is so hard. It really is. And do you know what support services are they at your hospital?
Yes, I do.
Yeah. Okay. And if not, reach out to Erin, because you deserve that. Yeah.
Yeah, it's something I've been through really, really bad things in life, but this is one thing I never thought I would go through.
Came out of the blue. I'm so glad you spoke up. And if at the end, please reach out to Erin. And Erin, if I can facilitate anything from North Carolina, let me know.
Okay.
Thank you, Migdalia.
Thank you.
Yes. Well, Catherine, thank you.
Yeah, of course. I'm so happy to be here. As Erin mentioned, I am a student at the University of Pennsylvania. I am a part of an organization called KESSM. And what we do is we host a week-long summer camp for kids whose parents or guardians are diagnosed with cancer, whether it's past or present, whether the parent is still with us or not. There are several chapters all across the country. I think you mentioned there are several in North Carolina. They take place all throughout summer. I know a whole bunch have already been happening for about 6 weeks now. Ours is happening exactly 1 month from now, so I'm very excited for that. But yeah, like I said, we are a support system for kids who are dealing with cancer. It's a hard thing to deal with. Desiree, I'm sure your kids can attest. I can attest. I was in 2nd grade when my mom was diagnosed with cancer. It is hard. It is hard, as Jean mentioned. You don't, depending on age, you don't know what you're dealing with. Some kids have never even come across the word before. Some know it all too well. And so, yeah, we host several events throughout the entire year, but our main flagship event is a week-long summer camp. The best thing about our camp, it is completely free. We try to make it as barrier-free. If you need transportation help, if you need finding supplies for camp, we help you with all of that. There is no cost. We host ours in Oxford, Pennsylvania, at Camp Saginaw. It is a beautiful campsite. We have so many activities. Like last year we went swimming, we went kayaking, go-karting, zip lining, all supervised, of course. We have arts and crafts, a talent show, and it is completely run by college students. We do have mental health professionals and nurses and one or two people from Camp Nationals who are adults and certified in what they do. But for the most part, it is completely run by college students. Even I know at our chapter, we have 2 counselors who are former campers themselves. So that's really special for them to be a part of it. And, I think it's very lonely. As prevalent as cancer is, it is very lonely when you are a kid and your parent is diagnosed with it and you feel like you can't talk to anybody else about it or your friends just don't get it. So when the kids come to camp, it really is just a beautiful experience to see them making these friends who really just wholeheartedly understand what they are going through. I've seen several campers who live hours away but met at camp and make time to go to each other's performances and basketball games, and it's so sweet. And we have kids who at the beginning of the week don't want to talk about it, maybe don't even know why they're there, but then throughout the week start to pick up on why they're there. And then they'll just kind of out of the blue ask you a question about cancer. And we don't have all of the answers about one parent's specific diagnosis, but we are there to help them through the big feelings that they're feeling. Something I've noticed with a lot of our campers is not only are they dealing with this, but a lot of them tend to be dealing with anxiety or ADHD, or they're neurodivergent in some type of way. And I mean, plenty of our campers are not, but a lot of them are. And I feel that that is also like a big help in that regard, because we have roughly about 90 campers and about 40-ish counselors. So the ratio is very small. So, everybody gets that like almost one-on-one care. And I think it's just really important for the kids. Our counselors are all screened, background checked. We go through an interviewing process to make sure that we're getting the best of the best to help. It's very cutthroat at Penn when we're picking counselors. But yeah, it really is just, we're trying to just broaden, expand who we are welcoming into the Kesselm community. Obviously, we want to be welcome to everybody, but we realize that there are some communities that we're just not hitting. And we want to make sure that we're broadening that boundary. But yeah, like I said, our camp is taking place August 11th through the 16th. There is still time to sign up. It is always, we take people until we're full. A couple other things I want to mention is that if, you can't come to camp this year, totally fine. We do other things throughout the year. During the fall and the spring, we have a Friends and Family Day, which is for both returning and new families. They come, we have food, tons and tons of food, tons and tons of games. It's a great time for parents to meet counselors, for kids to see one another, to meet each other, to reunite. So we do have that. And then at least once a semester, we also try to have virtual cabin chats, which are just Zoom calls like this, probably similar to your virtual hangouts, where the kids just get on an hour and we like play games, 20 questions. They love it. They get so excited and they just get to see one another again. That is also for new and returning families. Erin mentioned that I am an outreach coordinator. This is my first year. It has been so much fun because I am basically one of the 2 people who gets to speak basically one-on-one with families throughout the year. I am the one sending emails, posting on social media. I am usually at all of the events we host, all the cabin chats, and I really think I have the best job. I get to see the campers, not just at camp, but all year round. But yeah, and that is one thing that, people have said this year, and something I'm very proud of, is how much more communicative we are. I try to send out probably like 2 emails a month. So families are always on top of things. They always know what's going on in the Kesselm community. They're not going to miss anything. at any of these events we host, we also, if you need help with transportation, if you need gas cards, it's not just for camp. Like we're all year round trying to help with supplies and everything. But yeah, it really is just, Kesem is a great opportunity for kids to meet people who are going through the same things that they are, to talk about the feelings that they're feeling if they don't want to bring it up around a parent. And like I said, we have health professionals. We also have mental health professionals if talking to a counselor or talking to a college counselor isn't enough. But yeah, if you're interested, if you know anybody who's interested, you can email me. Erin and Sue will definitely share my email with you. You can also look up kesem.org to find our chapter if you want to register. Or if you want to join our listserv, again, email me. I can put you on that. That way you know everything that's going to happen for next year. But yeah, thank you so much for letting me speak.
Thank you, Catherine. And I have two thoughts. One is I've been referring families to Kesem chapters across the country since 2000. And in that time, I have literally had one 11-year-old who was too homesick and said she wouldn't go back. And other than that, I have had 100% not just happy, but enthusiastic response to Kesem. And Catherine, I wonder, does UPenn have a video, a Kesem video that you could send to Erin? So she could send it out, because I tell my families, I show them the Duke Kesem video so they can really see camp, right?
Yeah.
And if you could send that to Erin and she could share it, then that would be wonderful.
Absolutely, absolutely. And yeah, you were talking about the homesickness. I was a counselor last year and this year I will be with the littlest kids we have. I should have mentioned our programming is for 6 to 18-year-olds. And I'm always with the like 6 to 8-year-olds. And it is, those first few days, they're a little uncertain, especially, if they're new, they're not quite sure what to feel. By the end of the week, they don't want to leave. Yeah, they have the best time. And they remember, like I'll talk to families and they'll be like, oh yeah, what's your name? Oh, well, they remember you. And it's like, yeah, they cling on to every detail.
Wonderful. Thank you so much.
Of course.
And then Desiree, I do see that there's a question, but is there anything you would like to add before we move to that question and start to wrap up for the evening?
Actually, I just wanted to go back to Migdala, if that's okay. I know that she was, I was crying all the time, but particularly after my surgery, I really got into a dark place, and I did look for a counselor in a couple different places, but ultimately what I found was through my primary care doctor was able to set me up with someone through my insurance. So insurance actually paid for it. And I'm still, I plan on seeing her probably forever. But it does take a while to find the right person. Don't give up if you meet with a therapist and it doesn't work. I probably went through 3 different therapists. I think she was my 4th one that I felt like I really connected with, because it's important to find somebody who you feel comfortable with and also who can speak to your experience, right? Because it's a complicated thing that we're going through. It's not just the emotional feelings, it's like the physical changes to your body too. But I would say seek support. It was really important for me because I was in a very dark place after my surgery, and it really helped speaking with someone.
I'm gonna call my doctor tomorrow to find out. But just out of curiosity, does anybody know the side effects of radiation?
I think those really vary based on the dose you're getting and the location. So has your doctor had an opportunity to share that information with you yet?
No, they told me I had this week when I went, they did a CAT scan and they did the dots around my chest. And she said she'll call me next week and I'll have another set of dots done. And that day will be the first day of my radiation, but that's all I've been told.
Okay.
I was going to say,
I could jump in there a little bit.
Well, yeah, and I was going to say I can connect with you separately as well, just to kind of talk through what those potential side effects may be. And even from a nutrition standpoint, I'd like to make sure that we touch nutritionally how to really support yourself through radiation. So I sent you an email already, so we can certainly connect separately and we can go through all of that. And you are welcome to reach out to me, as often as you'd like and need.
I definitely appreciate that.
Yeah,
Wonderful.
Magnolia, that's a part of our programming. So you can have that one-on-one with Karen. We will cover all of those costs, and that will be really valuable in the nutrition end. As far as radiation, a lot of exhaustion comes with radiation. We hear that often from our community. There is something that we've learned, though, that if you actually can just walk 15 to 20 minutes before your treatment and 15 to 20 minutes after, there's actual science that shows that you have less exhaustion from radiation if movement is actually in the routine. So some people do a little yoga. We have some that are walkers, fast walkers, and it made a difference. And it can be anything that you just feel like you could do a little movement, and it's something you can do, which I know for me, when I was going through my treatment, I needed some kind of control to do something, and that
Right.
could be valuable. So before you get started, maybe, I don't know if you have a routine of walking around the neighborhood, or just think, okay, 15 minutes before, 15 minutes after, and see if that helps you with at least the level of exhaustion that sometimes people get.
Okay, thank you.
Yeah, you got it.
Thank you. And then Sue, do you see the question from Marta?
I did.
I know we're run
did.
over a
Yeah,
little, but I guess folks can drop off if needed.
Good. I'd be happy to share, Marta. I actually, oh gosh, Jean, you are remarkable. I wished I had your tools when I was sick, because I didn't do everything that you had said, and those words were really, they resonated with me, because my children were 7, 11, and for my conversation, my mom just passed away. So, it was a difficult time for our family, and my mom passed away in February. I'm diagnosed in April. And I'll start with your last question, Marta, was how do you tell your adult parents, right? Like my dad, I had to now tell my father his baby had breast cancer, and his mom died of breast cancer. So it was tough. So for me, I made so light of it. Like, I didn't even tell him the extent of the surgery, only because I just couldn't add more worry to him. Was that the right thing to do? I don't know. I don't know, but I just was like, Dad, I'm good. I don't want you to worry. It's nothing, no big deal. They're going to do, I even said a lumpectomy. I got to buy that on mastectomy. I don't think he was going to notice. Like, he wasn't, yeah. I did not want to make it to be something more that he had to worry about. And he's in my life he's been in my life, every day. I have conversations with my dad, and a very powerful relationship. So I addressed it that way. And then Chip's parents, my husband's parents, they were constantly so worried about me, and they would come over and bring meals and watch the kids, and the worry in their eyes would actually, it was harder for me to try and navigate their feelings while I was sick. And I just remember feeling like my husband sort of had to handle that. I didn't have the conversations, because I felt like now I have to worry about them worrying about me. And if there's one piece of advice I can say when you're going through treatment, just try and make it all about you. Because when you have to navigate so many people's other feelings, it gets to be really difficult. And it's not your job right then. And they're gonna be okay with it. The adults, they're gonna be okay with it, right? As far as my children, interesting enough, when this was coming up, I was like, I just wonder what they remember, because what I remember was very different. And I'll bring up one, which was my oldest son, and he was 13 at the time, and I felt like he really took it the hardest. It was a tough time for him. When I look at the year after, and I felt like maybe there was some suppression going on, right? Like maybe there was some things that he just didn't talk about. But interesting enough, there was, but the way he talked about it, when he was at that time, he was in 8th grade, and the kids at school, I was going into surgery, and the kids at school heard that his mom had breast cancer. So here you are, somebody's hearing it, right? And said, oh, your mom has breast cancer, she's gonna die. And I was getting surgery that day, and he called me up on the phone crying the nurse comes in, we're getting ready to go into surgery. So the emotion was so heightened. I'm like, oh gosh, no, like I am good. I am fine. Please do not worry. And they don't understand what mom has. And my son doesn't remember that. I asked him about it just recently. He does not remember that. And here I have been holding this for 20 years, right? Like I just, it was so heart-wrenching for us. And so he must have suppressed that. And he even said to this day, he tends to, like, when things are tough, he tries to do things that make him happy. And to this day as a man, you know, like when things are difficult, he tries to move forward and go and do things like golfing or cooking or going with friends, like things that make him happy. And I thought that was really valuable because he did that as a kid. He did do that as a kid. And so it was a very different memory. And I'm just so curious on, you know, here my daughter was 7 and my other son was 11, and what their memories were as well, right? Like, and what we ended up thinking. And again, I made very light of it. I just was saying, you know, mom has a disease. I don't think I used the word cancer. She's going to be sick for a little bit. I might not look too good. I'm going to lose my hair, but I'm going to get through. And I wished I had your words, Jean. They were beautiful. I wished I had them, because I think being clearer probably would have been better, right? And then it seemed like my husband sort of dove in and really took care of where I had to leave off, right? I couldn't quite be there, right? So I don't know if that helps, Marta, but you know, we all do the best we can with the tools that we have. I always say that to our community. Know that we have this beautiful tool here tonight with Jean, and listening to Desiree, and listening to Catherine, and we do the best we can with the tools we have. And now you have something new in your tool belt that you can use. And you have resources with Jean and Erin, and that's why Unite for Her is here, right? And they are tools that I didn't have. I remember not having them. I remember thinking I couldn't even get down and play with my kids. Like it was tough, right? And now know that Unite for Her is here with these really valuable types of speaking series and resources and people that you can talk to that have gone through what you are going through and aren't afraid to answer the questions and give you resources. So I hope that's helpful. Jean, I really appreciate you. I can't tell you enough what this segment meant to me, because it took me back 20 years, and we all do the best we can, right? And but when you have some empowering tools like we're presenting today, it's going to make it a little easier. Yeah.
And that is what I say, Sue, to the parents I work with. You can only do the best you can do with the information you have in the moment. And that's what you had for information. So
I know. I bought a book for the kids. I remember having a book, and it was okay. It was okay. I can't say I would be like recommending this great book. It was just okay, right? And it just, yeah. So I can resonate with everybody here tonight, because I think I felt a little bit of all of that. All right, Erin, what do you think?
That was great. And I just put Jean's final handout of a list of resources, Sue, you mentioned, in the chat as well, because I do think that is so important. But what a wonderful segment. And we appreciate all of you for being here and sharing your experience and your expertise, and Catherine being here to share, you know, a truly incredible national program with our members. So we appreciate your time this evening.